Hey, November is National Diabetes Month. Nearly 26 million people in the U.S. have diabetes. Because pets can be affected as well, it is also National Pet Diabetes Month. And our pet vet, Dr. David Vister, is here to explain this common and serious condition in pets. And I guess I've been surprised, you and I were just talking during the commercial break, really this is a widespread thing, isn't it?
Yeah, it is, and it's common in people too. I mean, there's millions and millions of people who have diabetes and are diagnosed every year. And it's frustrating because more, like 1 in 4 people don't even know that they have diabetes. And that, of course, is a type 2 type where they are developing it later. But in any case, it's only going to get worse when in 2050, they say 1 in 3 Americans will have diabetes. And part of it's an American issue and part of it's nutritional, but it's on the rise. And we need to be aware of the signs so we can manage that, but also be aware how to maintain ourselves to prevent it in as much way as possible.
And when we talk about people, and I told you, I'm a type 1 diabetic.
Yes.
And when I was diagnosed, I was aware of my symptoms. I lost a bunch of weight. I felt awful. But now with pets, they're not as self-aware and they can't communicate about what they're experiencing.
Yeah, the thing is they don't complain very much. They know what they have. They just go for it no matter what. They kind of have this optimistic approach, but of course that hides signs and symptoms from us a lot. So we have to stay tuned into those signs, even if they might be more subtle.
Okay. Well, give us a reminder, if you will, about the symptoms that we should be looking for and the threats when it comes to diabetes.
Yeah, I think one of the most common signs that people will notice is related to the thirst and urine production. Diabetes is a loss of sugar through the urine. It brings with it a whole bunch of water too. So increased urine production is probably the most common thing that people will notice. And that might be in the form of I need to go out more. It could be in the form of accidents. But drinking more than normal to make up for all of that water loss is another sign for people to be aware of. That urine production may be so great that they can't hold it all night, and even during deep sleep might even leak urine and leave some wet spots. But it's also possible for them to have accidents at home, and one of the unique things is that people might notice that as that dries, it has sort of a sticky feel, and that again is because of all the sugar that's inside that urine that they have. Weight loss is another common symptom as well.
Arguably, this gets worse as time goes on.
Yeah, so these are the initial signs, but as it gets worse, the toxicity that develops can cause pets to feel nauseous, vomiting, diarrhea. They can lose weight. This is one of the things we mentioned earlier. And what might have been an increase in the appetite earlier to make up for all the sugar that was being lost can turn into a lack of appetite. But that dehydration and weight loss really progresses quite a bit. And as pets become more toxic, they can also go into coma situations and even pass away from this condition. So it's just important to stay tuned into that and be aware of the severity.
So an animal can go to a ketoacidosis coma as well?
Yeah, and in fact, that's one of the more complex ways in which we diagnose this. Again, pets not complaining very much. We're getting into that diagnosis a little bit later than typical. And when it is ketoacidosis, that's one of the more downward spiral kinds of effects. And that often causes pets to need to be staying in the hospital to have their electrolytes manage the hydration and gradually bringing the sugar down to where it should be. But there's also pets who are diagnosed after early signs, and we can actually help them a little bit earlier than typical.
So in sort of a general scale, diabetes is probably a fairly simple thing to diagnose?
Yeah, it really is. Simple to diagnose, and that it's the blood sugar that we're measuring. Now, that may not be everything that we need to characterize the entire condition, but that tells us with almost certainty that high sugar, and usually normal sugar is between 100, 150 for pets. If it's up in the 400 range, there's no question, right? There are some gray areas in between where we're measuring it, and we wonder whether a pet is a little stressed or excited to be there, but once we know that this is indeed the case, there are some confirmatory tests that can tell us for sure that this is diabetes. But it is very easy to diagnose with a simple blood test, chairside at your veterinarian's office, to be able to find that high sugar.
So what's on the horizon? Are there any new treatments available?
You know, dogs mostly end up going on insulin when they have diabetes. There are lots of oral medications for people to help stimulate the insulin production, to help it work better and to provide more. Dogs don't seem too amenable to that. But cats have in the past been able to have some oral medication similar to what was used in people, but there's actually a new medication that is out that helps remove a lot of the sugar from the body so that the sugar or the insulin that remains can do its work without all of the heavy burden. And I brought with me the name of a product. This is one that we use in cats called Senvelgo, and this is basically similar to Jardiance, which you've heard and seen commercials in people. But what this does is it helps rid the body of that extra sugar and allows the insulin that remains to be able to do its job. And there are other medications that are in development. This, of course, is a common syndrome, and so it gets a lot of attention from research, not only what it can do to help pets, but also what that research can do to help people that have diabetes as well. So there's a lot of hope and support in this, but we need to continue with that research and have people be aware of what to watch for in their pets and honestly their own health to stay healthy and avoid what seems to be an almost epidemic proportion disease.
Now, presumably if we keep our pets fit, that has got to be go a long way toward prevention.
Yes, I say obesity is one of the main environmental factors. We're not going to buy a food that our pets aren't going to go ravenous over, but be aware that just eating a food doesn't necessarily mean you're giving the right amount. We need to keep them in their ideal body condition to prevent that exhaustion of the pancreas making insulin, and that's very important. Exercise and nutrition, we hear it a lot, that's going to be important.
He's our pet vet. He's Dr. David Visser. If you'd like more information on Pet Diabetes Month, go online to www.petdiabetesmonth.com. And if you have questions about diabetes and your pets, you can get in touch with your veterinarian or contact ours at the Center for Animal Health by calling 888-PETS-VETS, or you could always shoot Dr. Visser an email at michianapetvet@comcast.net. Stay tuned for more of 16 News Now on a Saturday morning. We'll be right back.